Memory Monday. Memory Monday is a weekly discussion every Monday evening. Each week we dive into a different topic related to brain health. It's super casual and an informative way to learn more about caring for our minds. Plus, it's a fantastic excuse to catch up and chat while we also are doing something good for ourselves. Today we will embark on this week's topic, inflammation in the brain, what you need to know. Our brain, the command center of our body, is vulnerable to the harmful effects of inflammation. While inflammation is a natural response to protect the body and is essential for fighting infections and promoting healing, chronic inflammation can wreak havoc on our brains. Let's look at the impact of inflammation on the brain and discover practical steps to minimize its effects, promoting a healthier and happier cognitive life. By better understanding how inflammation affects the brain, we can help preserve our cognitive health. Chronic inflammation can lead to various health conditions, including cardiovascular disease, diabetes, autoimmune disorders, cognitive decline, mood disorders, and an increased risk of neurodegenerative diseases like Alzheimer's and Parkinson's. That is why if we suspect any inflammation is happening inside our body, it's best to address it immediately. In the brain, inflammation plays a crucial role in developing amyloid plaques, abnormal protein deposits that form between nerve cells and disrupt brain function. The accumulation of amyloid plaques is a defining characteristic of Alzheimer's disease. Inflammation triggers the production of specific proteins called cytokines, which promote the buildup of amyloid plaques. These plaques in turn trigger more inflammation and cause damage to brain cells. This becomes a vicious cycle. A chronically inflamed tissue rapidly deteriorates and loses its function, resulting in impaired cognitive function and memory. Besides the amyloid plaque buildup in the brain, let's look at what else inflammation can do to the brain. Inflammation can disrupt the blood-brain barrier. The blood-brain barrier serves as a safeguard that controls the flow of substances between the blood vessels and the brain. Therefore, any disruption to this barrier can facilitate the entry of immune cells and inflammatory molecules into the brain, leading to increased inflammation and potential harm to brain cells. Inflammation can activate the brain's microglia. In a nutshell, the microglia are resident cells of the brain that regulate brain development, maintenance of neuronal networks, and injury repair. When there is inflammation, immune cells in the brain microglia get activated. Their activation is supposed to protect the brain by eliminating harmful substances. However, if this activation goes on for a prolonged period of time or is excessive, it can result in the release of inflammatory molecules that can actually harm brain tissue. Inflammation can cause neurotransmitter imbalances. A neurotransmitter imbalance is a chemical imbalance in the brain, which is said to occur when the brain has either excessive or insufficient chemical messengers, called neurotransmitters. Some people claim that these imbalances can cause mental health conditions. Disruptions of neurotransmitter imbalances caused by inflammation can impact mood, behavior, and cognition. Inflammation can cause also neurodegenerative diseases. Chronic inflammation in the brain is believed to play a role in the onset and advancement of neurodegenerative conditions like Alzheimer's and Parkinson's. Inflammation can also cause cognitive impairment. When there is inflammation in the brain, it can cause problems with cognitive function and lead to issues with memory, attention, and executive functioning. Additionally, it may impact mood regulation and raise the likelihood of developing psychiatric disorders such as depression and anxiety. Inflammation can impact our neuronal health. When you have inflammation lasting for a long period of time, it can harm neurons and interfere with their usual operations. This may result in the death of brain cells and and alterations in the brain structure, which can contribute to cognitive decline in the long run. It is important to note that the brain's response to inflammation can vary depending on the cause, duration, and severity of the inflammatory process. For example, acute and localized inflammation in the brain, such as that is caused by an infection or an injury, may have a different effect compared to chronic systemic inflammation. Additionally, individual variations in genetic factors, lifestyles, and overall health can influence how inflammation affects the brain. Now let's look at some lifestyle and environmental causes of chronic inflammation in the body and the brain. Consuming a diet high in refined sugars, processed foods, and unhealthy fats can trigger inflammation. Whoops, I did that one wrong. Okay. Sedentary lifestyles, smoking, and excess alcohol consumption can also contribute. Prolonged stress and negative emotions can result in chronic low-grade inflammation impacting brain health. Exposure to toxins, pollutants, and certain infections can provoke inflammation within the brain. Bacterial or viral infections such as meningitis or encephalitis, and also head trauma can initiate an inflammatory response within the brain, affecting neural circuits and functions. Some of the above causes we have no control over, but the ones that we do, we should make the necessary lifestyle changes to address them. Either way, it is important to not ignore the inflammation and have your doctor run tests to find its origin to reduce long-term damage. They can run tests and see if you have Lyme disease or have been exposed to mold, or if you have an autoimmune problem or bacterial or viral infection. This way, they find the specific issue and address it. Once you have been checked out and the doctor has determined the possible cause and treated it, you continue with the lifestyle habits to keep the inflammation at bay. By understanding the harmful effects of inflammation, we can appreciate the importance of maintaining an anti-inflammatory lifestyle. To minimize inflammation in the body and the brain, pay attention to the foods we consume or lifestyle habits and surrounding environment is crucial. Specific dietary components such as processed sugars, unhealthy fats, and refined grains can promote inflammation. On the other hand, consuming anti-inflammatory foods can help combat inflammation and support brain health. So again, we want to embrace a diet rich in fruits, vegetables, whole grains, healthy fats like omega-3 fatty acids, and lean proteins to reduce inflammation and nourish the brain. We want to engage in physical activity to reduce systemic inflammation and promote brain health. We want to adopt a stress reduction techniques like mindfulness, meditation, yoga, and deep breathing exercises to combat chronic inflammation and protect your brain. And prioritize sufficient and restful sleep, as it allows the brain to recover, repair, and fight inflammation. Also including foods rich in antioxidants such as blueberries, leafy greens, and turmeric, which can help reduce inflammation and support brain function. And finally, minimizing exposure to environmental toxins. If you're smoking, quit smoking, and limit alcohol consumption to reduce the risk of brain inflammation. Again, remember to consult with healthcare professionals for personalized guidance on managing inflammation and optimizing brain health. They can provide tailored recommendations and monitor any underlying conditions contributing to your inflammation. Now let's look at 10 superfoods that are great for fighting inflammation and nurturing the brain. One is blueberries. Blueberries and other berries also are rich in antioxidants and flavonoids, which have been shown to reduce inflammation in the brain. They also enhance brain function and memory. Fatty fish like salmon, mackerel, and sardines contain omega-3 fatty acids, which possess anti-inflammatory properties and support brain health by reducing inflammation and promoting neuronal communications. Turmeric is a curcumin, which possesses potent anti-inflammatory effects. It has been associated with improved brain function and a reduced risk of neurodegenerative diseases. Leafy greens like kale and spinach are full of antioxidants and nutrients that combat inflammation and support brain health. They promote optimal cognitive function, and promote against age-related cognitive decline. Kale contains antioxidant quercetin and camphorol, which lower the production of pro-inflammatory molecules, thus reducing inflammation. Walnuts are a terrific source of omega-3 fatty acids and antioxidants. Their anti-inflammatory properties contribute to improved brain function and cognitive abilities. Avocados are abundant in monounsaturated fats, which have anti-inflammatory properties, as well as essential nutrients like magnesium, fiber, and potassium. Cruciferous vegetables, including the kale mentioned above, cauliflower, Brussels sprouts, and broccoli, are excellent sources of folate and vitamin A, C, and K. Broccoli is packed with antioxidants like sulforaphane, which helps combat inflammation and reduce the production of cytokines. Green tea has been touted as one of the healthiest beverages, primarily because it contains a powerful antioxidant known for its anti-inflammatory properties. Regularly drinking green tea has been shown to reduce the risk of heart disease, cancer, obesity, and Alzheimer's disease. Olive oil is a beneficial substitute for other cooking oils due to its high content in monounsaturated fats, which are considered a healthy form of dietary fat. Extra virgin olive oil stands out as the most natural and superior choice, as it possesses potent anti-inflammatory properties. These properties enable it to effectively combat inflammation and reduce the risk of conditions such as cancer, arthritis, and heart disease. And tomatoes. Tomatoes are widely recognized as the primary source of lycopene in the American diet. However, other red-colored fruits, such as watermelon and papaya, contain significant amounts of this nutrient. Lycopene belongs to the carotenoid group, which includes plant compounds that serve as precursors to vitamin A. With its potent antioxidant and anti-inflammatory properties, lycopene is crucial in preventing chronic degenerative inflammatory conditions. Chronic inflammation poses significant risk to both the body and the brain. We can reduce inflammation and support brain health by adopting an anti-inflammatory diet. Incorporating superfoods such as those mentioned above can also help combat inflammation, protect against neurodegenerative diseases, and enhance cognitive function. Remember to consult with any healthcare professional or registered dietitian for personalized advice regarding dietary choices and health conditions. I want to thank each of you for joining us tonight. I'm hoping these weekly gatherings will enrich our understanding of brain health and strengthen our bond as a community. Let's keep learning and look forward to having fun chats in the weeks ahead. And now I'll go ahead and we will open up for questions and answers.